I'm Dr. Tawainna Houston, and I'm here to talk about Black maternal health disparities that are not improving. Pregnancy and childbirth are natural processes, yet Black women are still dying at 3.5 times the rate of white women. The CDC has already told us that over 80% of all pregnancy related deaths are preventable. And for Black women, equitable access and most importantly, equitable treatment would save lives. And when we hear the word treatment, let's just talk about that. We think of care, evaluation, monitoring, compassion, and responsiveness. But we are seeing in hospitals across this country the exact thing going on in some of them. And in just the past 2 weeks, we have seen these incidents that took place, one in Indiana and one in Texas. And it has shown us with just real time video footage what it looks like when when Black pregnant women in distress are met not with medical care, but with indifference, dismissal, and complete absence of humanity. And so let's talk about these two incidents briefly and what exactly happened. And so the first one was in Crown Point, Indiana, where Mercedes Wells, she was discharged while she was having active labor. Her contractions were 3 minutes apart. And without ever being evaluated by the physician after several hours of being there, the video footage shows her simply, she was wiping away her tears as she was rolled out in a wheelchair to her car. She was clearly in pain and needing help. And within 8 minutes later, her daughter Alina was born in the car on the side of the road instead of the comforts of a hospital room. And she was delivered by her, the baby was delivered by the husband, who was not a medical professional. And they were turned away from the building filled with those who were medical professionals. And Mr. Wells, he said he felt that the hospital didn't want him there. His wife's pain was dismissed. Her medical needs were ignored. Her humanity was violated. And Franciscan Health Crown Point Hospital, they failed, not just in clinical care, but in basic compassion. And then around the same time, in Mesquite, Texas, at the Dallas Regional Medical Center, the story is painfully similar, where you have Kiara Jones, who arrived in active labor as well, but the staff moved with no urgency, no empathy, no care. Her mother, Kashina Manuel, saw where all this was headed, and she did what Black families must do these days for her own self-protection of being possibly legally dismissed. Sister pulled out her phone and began recording. So thank God for recording devices on our phones that we get to walk around with, that are finally capturing the experiences that we have endured for centuries. And so, in only 6 minutes after Kiara was finally taken to her room, y'all, her son's head emerged soon as her bottoms were removed. And so, what that means is if the staff had acted sooner, her labor could have been supported more safely and calmly. But instead, her mother is having to sit back and watch all of this and silently restrain her rightful fear and anger because the angry Black woman stereotype is a real deal. And that could have made her the target of a threat to the hospital staff, who was already neglectful in providing the care that her daughter needed. So imagine that, watching your daughter in pain and being forced now to perform emotional suppression to keep her safe. How many Black mothers do that all the time? And Kashina said she had to put her emotions on ice. As a doctor and as a Black woman, I am enraged. And I quote the late Marvin Gaye saying, "It makes me want to holler and throw up both my hands." Because it is 2025 and Black women in hospitals, places that are meant for healing and protection, are still being met with coldness, with disregard, and dehumanization. And it is heartbreaking, it's infuriating, and it is not far from our history. In 1619, 1719, 1819, Black women's maternal pain did not matter. And today, in 2025, we are still seeing echoes of the same disregard, and it is not illegal to do so. We were not seen as humans then. Too often, we are not treated humanely now. Yeah. This is a systems issue, but it is also a humanity issue. Medical environments are supposed to reduce stress, not elevate it. For a pregnant woman, especially a woman in active labor, stress can quite literally turn an already delicate situation into a dangerous one. And very extensively, I talk about stress in my book, Black Wellness Barriers. And this is exactly why I wrote the book, to help Black families and communities and medical professionals understand that the past is not the past. It lives in our healthcare systems. It lives in our outcomes, and it lives in how we are treated the moment that we walk through the hospital doors. Failure to acknowledge history is exactly what allows these incidents to continue over and over again. And unfortunately, I wish I was just talking about Black maternal health. I wish I was. But these are acts of neglect that fuel the ongoing distrust of the Black community at large, and the distrust that it has towards the medical system. So let's just keep it real. When Black women are turned away in labor, what message does that send? What it says: your pain may be ignored, your symptoms may be dismissed, your concerns may be minimized, and your presence may be treated as a burden. And that right there, y'all, It is that message that contributes to the late diagnosis, the delayed care, and the poorer outcomes across the board within the Black community. If we can't trust the system during something as profound as childbirth and delivery, why should we trust it with a headache or chest pains or any other thing? But let's be clear, we must seek out care when our bodies are signaling distress. No one should be shamed or dismissed for valuing their own health enough to get the issue evaluated early. What we must do better as a nation is not just about doing better with the policies, but more importantly, we must do better as human beings. Black women should not need laws to guarantee humane treatment, but yet here we are. And while policies matter, the deeper issue is empathy, care, and humanity, especially if you are going to be working in the medical field. Because what happened to Mercedes and Kiara should never happen to any woman ever. It is a shame, an absolute shame, that pets receive more universal empathy in this country than Black women who are forced into a position to fight for their lives while they are giving life.